Hey everyone, Dr. Justin with DPT. I want to go over having your pelvis aligned. If you're a patient of ours or a future patient of ours, you'll know we always check your hips first thing when you come in. And you might have a malaligned pelvis, and we understand that the pelvis is kind of where everything starts. And if this isn't aligned, we're going to have problems not only up the chain, but down the chain. Now when you come, you might have what we call a right anterior rotation, or you can have a left anterior rotation. So just be sure and be cognizant when you come in that we tell you which type you have, and this is going to be a way you can align your hips when you're at home, and it's called an MET. So I'm going to come down to the ground here, and I'm going to show for a right anterior rotation. So we're going to actually use our own muscles to help correct our pelvis. What you're going to need is some type of dowel or a broomstick or something along that lines. And then I also use a yoga block that I want right near me. But if you have like a thick book or something that you can squeeze in between your knees, that'll work as well. So for my right anterior, I want my right leg to be a pusher and my left leg to be a puller. So to do that, I'm gonna go like this with the stick. And you might have to come to the side here. So you can tell my right leg, I'm gonna push into the stick, while my left leg pulls up. So I'm gonna actually use my own muscles to help align my pelvis. Hands are gonna be here to hold the stick and keep it neutral. I'm gonna push and pull for 5 seconds. 5, 4, 3, 2, 1. Relax. I'm gonna do that 5 times here, using my own muscles here to help correct my pelvis. There was 2, 3, 4, last one, 5. I'm going to put my feet together, knees up. I'm going to right away grab this yoga block. I'm going to squeeze the yoga block between my knees for 5 seconds. 3, 4, 5. And then sometimes I'll even do different ones where I'll have it where my knees are more together and more apart. I'm gonna do this 3 sets of 5 seconds. 5, 4, 3, 2, 1. My last one. 5, 4, 3, 2, 1. So now that my hips are aligned, I want to start doing some neuro reeducation exercises. First one, supine march. I have a flat back, I flatten it down where I can actually, almost like I'm trying to crack an egg with my back. March my feet. I would do this 15 times each. Next, I would go into a rock back. Right here, and I'm gonna push my butt towards my heels and come back. 15 here. And then finally, we're gonna do what we call a hip hike to work on our multifidi. I'm gonna put a towel or something underneath one knee, and then my other knee, I'm just gonna bring it up to where it's level. So it's a really small movement. As you can see, I'm not leaning. I'm just bringing my knee up to level, slowly bringing down. And with those exercises, our hips should now be properly aligned. You might have felt a pop while you were doing the push-pull or squeezing that yoga block to kind of get the hips locked in place. And now you should have nice aligned hips, and that should help some of your pain. If you have any questions, please hit us up.